Srimati Prabha Mallikarjun.
Speaker.
Honourable Madam, I rise to speak on the Health Securities and National Security Cess Bill 2025, not with statistic alone, but with the lived reality of Indian families. A mother in rural India still walks miles under the scorching sun of a simple vaccine. A daily wage worker still falls into debt for a hospital bed. Health is not an accounting entry, it is human dignity. Speaker Madam, healthcare in India is fundamentally delivered by the states, the PHCs, the CHCs, the district hospitals, emergency care. Federal balance is not decorative, it is engine of our healthcare system. And no national security structure can stand on a weakened foundation of fiscal federalism. This bill proposes a new cess on machines and processes used to manufacture pan masala and tobacco products. The intent may appear noble, but our duty as people's representative is to examine its very architecture. First, this cess is outside the divisible pool. States who run almost the entire public health machinery will receive nothing. Past cesses have remained unutilized, untransferred. Without a non-lapsable fund, independent audits, mandatory reporting, this bill risks becoming yet another opaque revenue system, although the finance minister did mention that this cess will be divided with states, but it is nowhere mentioned in the bill. Madam, this is not an exception, but has become a norm. Cesses now form around 14.8% of union taxes, which increased from 9.5%. Rupees 94,036 crore from the education cess, rupees 3.69 lakh crore from various other cesses has never been transferred to the designated funds, exposing systemic opacity and eroding federal trust. Additionally, the bill merges two important objectives, health and national security, into a single cess. This dilutes clarity, increases the risk of diversion, and makes auditing across two priority sectors very difficult. Instead of strengthening cooperative federalism, this bill creates a parallel stream outside the GST framework, exactly what the 14th and 15th Finance Commissions warned against when they urged raising states' share above 41%. Yet we see another levy that bypasses states entirely. Speaker Madam, let us confront the public health burden this cess claims to address. As per the National Academy of Medical Sciences 2025, India records around 130,000 new oral cancer cases every year, and tragically over 75,000 annual edits, which is among the highest in the world. A 2023 national study shows that patients spend on an average rupees 1 lakh out of pocket for oral cancer treatment, and 96% of families experience catastrophic health expenditure, meaning the illness destroys their financial stability. This is a real economic burden which India is facing. Therefore, if we levy a cess in the name of health security, let the bill clearly require that every rupee collected must be ring-fenced for cancer screening, early detection, NCD management, palliative care, and strengthening the state healthcare systems. Not a paisa should disappear into opaque accounts, like it's been happening. Second, the bill imposes heavy compliance burdens on small and medium manufacturers, liabilities up to rupees 25 lakh per month, and grants sweeping powers of search, seizure, and arrest. Regulation must not become intimidation. We must also acknowledge another reality. The tobacco ecosystem employs nearly 36 million people, farmers, BD rollers, small manufacturers, transporters, packers, and this reform cannot be built by pushing the poorest to the edge. Therefore, Madam, I propose three constructive amendments. First, a turnover-based exemption threshold so that small and medium manufacturing units are not crippled by this cess and shielded from crushing compliance. Second, a dedicated BD workers' livelihood transition and welfare fund offering skilling, microcredit, health protection, and pathways to alternative livelihoods. Third, a statutory requirement that a fixed percentage of the cess be transferred to the states to uphold fiscal federalism and equip the states to handle tobacco-related disease burdens. Speaker, Madam, let us situate this in India's broader health context. India still spends just 1.9% of GDP on health, which is far below even our own national health policy target of 2.5%. Supplementary grants every year show chronic under-budgeting. If health is a priority, it must appear in the union budget and not in the last-minute cesses. We have around 31,882 PHCs at the grassroots, but many still lack doctors, diagnostics, 24/7 services. The ruling party mentions dash number of aims with a lot of pride, but in reality, we all know these aims are without specialists, mandatory health services, and long appointment waiting lists. Quantity without quality cannot deliver health security. A PHC without a doctor is a building. A CHC without diagnostics is just a signboard. This bill assumes higher taxation will curb addiction, but addiction cannot be fought with taxation alone. We need awareness campaigns, counseling, cessation clinics, and behavioral support. A cess cannot rebuild lives. A roadmap will definitely do, ma'am. Speaker, Madam, India needs a genuine alternative, raise health expenditure to at least 3% of GDP in the union budget through transparent budgeting. Treat states as equal partners in health planning and implementation. Strengthen PHCs, CHCs, district hospital, and even the pride of our nation, aims. Focus on quality services, not just numbers. Publish annual health security accountability statements. Launch a national cessation support mission for addiction treatment and behavioral change. Speaker, Madam, this bill collects revenue from the people but withholds trust from the states, and without trust, no health system can endure. I would like to quote a line from Sri Rabindranath Tagore's work. Faith is a bird that feels the light and sings while the dawn is still dark. Let us not darken that faith with opacity. Let us build a system where every rupee is accounted for, every state empowered, every worker protected, and every citizen secure in health and thereby in national security. Lastly, Madam Finance Minister, I wish you keep in mind the health of economy, which is in dire straits as we speak. You propose to generate revenue for defense expenditure, which is becoming costlier because of rupee, which is in free fall. Thank you. Jai Hind.